there was a guy, a young kid, he presented with a trauma और उनके fracture भी था, उनके arteries में भी injury थी, and he was only in his early teenage, and they were asked to go for amputation of the leg, which is cutting the leg. I remember we had a combined discussion, we planned for reconstruction, and although it was a contracted long course after the procedure, but that child made it. He was able to walk, and I still remember the smile and the happiness on his face when he got to that point. Assalamu alaikum. I'm Dr. Fareed Ahmed Shaikh. I'm one of the vascular surgeons, and I'm an assistant professor and the section head for the vascular surgery. So I basically come from Larkana. I had my basic education there, and then I got into Dow Medical College. After graduation, I did my house job in Civil Hospital, Karachi, and then I always aimed for having a training in a very like reputable, prestigious institute like AKUH. So I had my training at AKUH for the general surgery, and then that got me into vascular surgery, and then I had a chance to join as a faculty at AKUH. When you see a patient of trauma, his vessels are injured, his limb is at stake, and if you don't take care of that then and there, he's going to lose his limb. And remember, trauma patients are mostly young patients who are the bread earner for their household, and they are the main support for their family. So that gives us the most joy when you save those limbs, you save those lives ultimately, and then you see those people coming back on their feet and back to their normal life. My father is a surgeon as well. He's a practicing general surgeon, but he's retired as a professor of surgery and the vice chancellor of the university there in Larkana. So I still remember I was around 10 years old, and when there was some concert evening, it was a giant auditorium there. It is still there, around 1,000 seated. They used to give some awards, annual awards to the faculty, and I still remember he got the best teacher award, and there were certain other awards given to the other faculty members. And the whole house stood up on their feet and clapped for him for good 5-10 minutes until he went to the stage, received the award, and came back. And then, I'm being honest, I mean, that sparked a lot of interest and curiosity in my mind that what has he done? Why is he so famous and his people around him? So that sparked my interest in surgery. So I was very clear that I want to be a surgeon. My father never forced us to be a doctor to start with, but then never asked us to be a surgeon. So that's our own interest. So when I came to AKUH as a resident year 1, I got to know about vascular surgery, and the interest further deepened when I met Dr. Ziad Sufi, who is called father of vascular surgery in Pakistan. So that further consolidated it, and I got a chance to rotate in vascular more than normal, that is 3 times during my residency. So that's when I finally decided that I like this specialty and I would like to pursue it as my career. It's really hard to balance that thing, and I respect the expectations from our families because obviously they need our time. And on the other aspect is our patients, because they have high hopes and they expect you to look after their problems. So I try my best. I have a day and a half where I get free on time. So I prefer going home, staying with my family. My kids are young, so maybe playing with them, taking my family out or some dinner or maybe some time out. Yes, I do. I love to play cricket and also watch cricket. I wasn't a football player at all, and neither do I have any skills that I can say I master in. But after the COVID set in, the faculty group at AKUH, spearheaded by Dr. Solat Fatmi, we started playing football, and we still do twice a week. Sometimes we are not able to make it because of our clinical commitments, family commitments, but we enjoy it the most. That 1 hour that we do gives us the feeling of that I have done something different today, like some physical exercise, some peaceful mind activities, and free of our stressful life. That's one. And the second I said is the cricket. We always participate in our annual cricket tournament that's done university wide, and we don't play cricket regularly apart from that, except for some Sundays. We go early morning on Sundays and playing where Dr. Salim Islam is our main driving force. We enjoy that time as well. And the best part is that we wake up early, we play, we come back, and still our families are mostly sleeping, so we don't actually lose any time there. So that gives us the most joy. And one other hobby is I like photography, but I don't really do it because I don't get time to do that. But whenever I travel, I enjoy that as well. It's an emergency based specialty, तो आपको आधी रात में उठ के आना पड़ता है. You have to rush into the hospital, but the joy and the happiness that you get after you do that is immense, I would say. It's matchless. So it's in every specialty. So वो एक common फिक्रा है कि जब प्यार किया तो डरना क्या. तो जब आपको एक चीज़ पसंद आ गई है तो आपको करना है, and you would do everything, you would try to the best to reach to that. तो वैस्कुलर सर्जरी के ऑप्शंस पाकिस्तान में अब बहुत अच्छे हो गए हैं, बहुत सारे इंस्टीट्यूट में होने लगा है, एंड इट्स एन approved fellowship, and you have options for going abroad as well. So I think I am happy to meet anyone who is interested in vascular surgery. You can reach out to me through my email, through our department, and I'll be happy to mentor or to do some counseling session for those who are interested in vascular surgery.